Johnson Dermatology is excited to announce that we are now accepting appointments for the UltraShape. The UltraShape is a permanent fat cell destruction pulsed ultrasound device. Right now we are here with Pedro, who has treated tons of patients. He was one of the first people to use the UltraShape after it was FDA approved back in 2014. Pedro, why don't you tell us the science behind the UltraShape and how it works?
Sure. So UltraShape uses focused pulse ultrasound, and what it does is it does it at different wavelengths. So basically, shakes the cells and pops them immediately. So at that point, right now with Dr. Johnson, we actually are destroying her fat cells right now, and so in a couple of weeks, she's going to see the results, and the area that we're treating is going to get smaller.
Great. How many treatments will we expect Dr. Sandy to need?
So we actually do 3 treatments. We space them out 2 weeks apart, and then a month after, Dr. Johnson would do her follow-up, and we'll get her post pictures then.
So when can she expect to see results?
A month after her last treatment.
Great. So Dr. Sandy is over here getting her treatment now. You can kind of see the straps that we have put on so that we can really get all her fat cells in the right spot that we can focus on. Dr. Sandy, how are you feeling?
Feels good. A little bit of warmth, nothing, almost like a massage the way she's pushing down. Feels good.
So Pedro, can you tell us a little bit about how this device differs from other fat destruction devices?
Sure. So number one, it's completely painless. You don't have any side effects like bruising or numbness or anything like this tingling and sensations you'll get. For example, with cryolipolysis, you have something called late onset pain. This does not give you anything other than just maybe a small little sensation of warm. That's it.
This is something that we can offer our patients as an alternative to liposuction for people that are not surgical candidates. This is considered a no downtime procedure. Are there any contraindications or any patients that cannot have the UltraShape done?
So any contraindications is any kind of defibrillators that they might have. But at that point, there's really nothing that is preventing a patient from getting this treatment because it's very localized. So as long as the skin is healthy and there's no rashes or anything present, you can treat them.
Great. And what is the aftercare?
So post-care, it's super important to drink plenty of water. Since we have actually destroyed these fat cells, you have to stay very hydrated. That way your body can filter it out. Something to be very, very cautious of is drinking alcohol for at least 3 days after. No alcohol, just pure water. And that way your body can focus primarily on removing the cell waste and processing those triglycerides that were released into your system.
And Tasha was actually treated earlier today, and now she is back to work treating Dr. Sandy. Tasha, are you having any pain from your treatment earlier?
No, not at all. I can't tell I had it done.
Great.
So I can work out tonight. I can do everything like normal. Plan to meet my friends for my 5 a.m. run tomorrow morning.
Exactly.
Fit into those skinny jeans, hopefully. But despite running my marathons, can't get rid of that fat from having 2 children.
That's the good thing for this treatment is you just come in, lay down for a couple minutes and leave and nothing changes. You're not swollen, you're not sore, tender, you're perfectly fine.
Right.
And so the UltraShape is the device we're using right now. Tell us about the VelaShape.
So the VelaShape is a radio frequency device that helps tighten skin and actually get rid of cellulite. It's warm and at some point it's a little uncomfortable, but the results are amazing and you actually see great results within just a couple of treatments.
So a lot of people are going to want the fat destruction from the UltraShape and then the skin tightening and the cellulite treatment with the VelaShape, and we will be offering both of those treatments and you can get them in a package. We do ask that you have how much fat to get treated. So if people call and ask how much they need to have to be treated, what would you tell them, Pedro?
So for a great candidate, you want to have an isolated area of fat, at least an inch to pinch. That way there's enough space for the ultrasound to go down there and destroy that fat layer. If the patient is too skinny or too heavy, this might not be the treatment for them, but I would recommend coming for a consult and let Tasha actually assess you and make sure that you're a good candidate for it.
Great. So this is really for body contouring. So getting that shape that you want, that, like Dr. Sandy said, you just can't get even when you run marathons and crazy miles to work every day.
Absolutely. Or having 2 babies.
Right. Yes, yes. And so what different areas of the body can we treat with the UltraShape?
So the UltraShape is FDA cleared for abdominal use, with other studies for other areas on their way.
We all use multiple drugs and devices off-label, however. And so I plan to be treated off-label for the sides and my thighs and maybe even some of that stuff on the side of my chest up here that I don't like. As you know, I've studied multiple devices for quite a few years, and it takes some time and it takes some money and investment to have these treatments done, and it wasn't until the UltraShape that I have felt comfortable picking a machine for me personally and for our patients. I feel really good about the science and the technology of this device, and I think you will be happy getting treated also.
And so for those of you that are joining us, we have quite a few new followers. This is the UltraShape that Dr. Sandy is having done right now. It is pulsed ultrasound waves, and it is immediately breaking up her fat so that it can be excreted by the body and metabolized, and she will have permanent fat destruction in this area. And she will have a total of 3 treatments. And somebody just said you were perfect, Dr. Sandy, just so you know.
That was very sweet.
Another good thing to note with the UltraShape is that you can fully customize it to the patient's need. Where the other devices, you have to fit a certain applicator. With this device, we were actually able to draw exactly what we wanted to target with Dr. Sandy.
Great. Is there anything else that you want to tell our patients, Pedro, while you're here and have the opportunity?
The world of non-invasive fat destruction is so big now, so the fact that you guys have this available for them is amazing. Pain-free fat reduction. Look how comfortable Dr. Sandy is just getting rid of her fat.
This is much easier than that.
Great.
But diet, exercise, it's all part of the plan.
Definitely.
We all are honored to offer this device to our patients now, and we are bringing it out during our 10-year anniversary celebration. August is going to be a great time to come to our clinic. Dr. Garrett Nelson is joining our team. We are offering multiple promotions and celebrations as we celebrate our 10-year anniversary. Hopefully all of y'all have seen our team video, because as you know, we just can't stop the feeling.
So with that being said, I would encourage all of you to at least make a free cosmetic consult with Danny, our cosmetic concierge, or come in and see me or Dr. Sandy for all your cosmetic needs. I will go ahead and give you a little spoiler alert that with the UltraShape and the VelaShape in the month of August, we are going to have maybe free gifts while supplies last, or specials on these. So you guys stay tuned with our Snapchat and our Instagram and our Facebook Live. And these spots are already filling up, so I encourage you guys to make your appointment today. Run, do not walk to Johnson Dermatology in the month of August. We look forward to seeing you guys. Have a great day.